Hello, I'm Dr Jemma Gilchrist. I'm a clinical psychologist from Mind My Health, which is based in Sydney, and I'm also the co-owner of Treat Me, Treasure Me. And today I thought we'd come and talk about being frightened of the cancer coming back, actually. And the term that, if you read about it, you'll see in research and so on, is fear of cancer recurrence. But really feeling worried about the cancer coming back and facing that possibility is something that pretty much everybody does at some point when they've been diagnosed with cancer and treated for cancer. And the first thing I want to say is that is completely and entirely normal. And how long it lasts actually varies a lot. And some people really say to me, oh, look, I'm so fed up with this constantly being on my mind. How do I get beyond it? How do I stop feeling anxious? And, for some people, the feeling fades away reasonably quickly. But for many, many, many more, it lasts and lasts. And for some, it can last for years. And it has its peaks and troughs. And it can be a bit of a roller coaster, as most of these sort of, complex things can be. But certainly feeling worried about cancer coming back is something that's universally shared, not only for the people that went through the treatments themselves, the patients, but also for those, those around them, those that care about them, those that love them. So I wanted to talk about a little bit about what fear of cancer recurrence actually is, and then we're going to go through some tips and pointers of things that you might want to think about to help. Okay. So the first thing I think to be aware of with being frightened that the cancer will come back is, for some people, actually that fear starts right at the beginning, right at the first diagnosed. They're already thinking about, okay, I'm doing the treatment, but what's after the treatment? But I think it's fair to say that for most people, as they come towards the end of treatment is when they really start to think about it. So when the appointments slow down, not coming to the hospital quite so much, not so many appointments with the doctors, then it can feel like the apron strings are cut, and people can feel pretty unsafe, actually. And some people who've had a lot of treatment and have been involved in cancer services pretty intensely for sort of 18 months or something, that experience can be quite different from someone who may have, for example, had a mastectomy for a precancer or DCIS, and they've decided, gosh, I've had this mastectomy, but whoa, I'm discharged already. And so, it's different, obviously, for everyone's experience. But for most people, it starts to kick in really at the end of treatment. So there's a really good chance to think, okay, how am I going to take control of this thing? Okay, rather than just simply waiting for the cancer to, the fear of the cancer to fade away and go away, actually do something about it, and share that feeling with the people that you know, because you might feel like you are insecure and unsure, but people around you might feel like, hey, you feel great. Hey, the treatment's done. How wonderful. They might expect you to feel elated and relieved and grateful and just enlightened that you've got this sort of life back. And actually, for most people, and we'll talk about this in another blog, but for most people, they don't feel that way at all. They actually feel pretty lonely and scared and isolated and worried about how to say to the people that they care about, look, I don't feel the way that maybe I should feel, or other people expect me to feel, but what I do feel is kind of scared and worried. So if you're one of those people feeling scared and worried, tell other people around you, share that, because they can't be expected to know if you don't share it. Okay. So what do you do about feeling frightened about the cancer coming back? Well, step one is don't try and do that alone, and tell the medical team, your treating team, that you feel scared of it coming back, and get the information that you need. So maybe there are some things that you can do to reduce the risk for your particular cancer. Okay, and maybe that's about some of the treatments that you might be recommended to have, and maybe it's not. Maybe it's lifestyle factors. Okay, now obviously there aren't these things that we can intervene with every cancer. We don't have that level of understanding yet about causes and effects of cancer. But sometimes there are things that you can do, and it's worth having a chat to your medical team to say, look, what are the things that I can really make a difference in? And then be flexible and think about how they might actually apply to your lifestyle. Okay. And I say that it's really important to get proper information. Don't go just randomly searching on the internet for things that you think might help. Some of those are evidence-based, many of them are not. And if you think, the day before you took a job or the day before you got married, you didn't actually think, well, hopefully you didn't think, I'm going to search on the internet and speak to everyone who's ever been married and see exactly what they think about whether I should get married or whether I should take this job or whatever particular thing it is. Because you know what? They might not be right and they might not be you. They're not you. So please really think twice about searching for all this random stuff on the internet about whether or not it's actually going to help you. The internet doesn't know your story and your particular set of circumstances, and your medical team and your support team are more likely to be able to, of course they don't have all the answers, but they're more likely to be able to target things for what you need. So get the information you need. Part of getting that information that you need is understanding the surveillance that you need. Okay, so follow-ups differ. They differ for every cancer. They differ for often about where you're treated as well. Whether you're treated in a metropolitan centre, whether you're treated rurally or remotely, what kind of specialist access you have. And so just chat with your team. How often do I come along? How often, do I see, which doctors do I see? Which doctor follows me up? Is it a medical oncologist? Is it a radiation oncologist? Is it the surgeon? Is it a combination of all three? Is it my GP? And don't forget your GP and your follow-up. Your GP has often been a really, really important part of your care, and they will continue to be. So think about and chat with your team about, who do I ask for particular things? If I've got a particular symptom, I want to know who to go to and I want to know how to get a hold of them. So, find out who follows up, what surveillance you actually need, and make sure that you're not falling through the cracks of a particular system, because sometimes that does happen. Cancer treatment and follow-up is complicated. These are big systems. They're marvelous systems for the most part, but you need to be engaged in that yourself and understand, what is it that you really, really need to do. And if you don't really, really know, then you've got to ask, okay? When I was talking about don't search on the internet and all that sort of stuff, be sensible what you're searching, be sensible about who you listen to in your personal life too. A lot of people that will start with, gosh, how wonderful, that you finished your cancer treatment, but gosh, my aunt did that, and then you'll never know what happened to her because blah, blah, blah. No, you don't need to listen. Put a stop to those kind of people, because sometimes they're just talking, and even as they're talking, they're thinking, why am I saying this? But yet this drivel is still coming out of their mouths. Stop. Say, look, I only listen to stories with happy endings, and I really know it's well-meaning, but I just want to stay with my own bit at the moment. I'm listening to my team, and I'm listening to those people that are looking after me, and that's what matters to me at the moment. So thanks, but let's just not go there. Find some words that you can choke out that you feel comfortable saying to go, no, okay? You feel vulnerable, and when you feel vulnerable, you need to feel as if you've got reliable, dependable strength and security around you. And people putting their two cents worth, 2 bobs worth in all the time is going to be really, really unhelpful. The other thing that's unhelpful is turning into a complete stress bucket and monitoring every single symptom all the time. It's normal, but it's not helpful. Okay, and it takes time to trust your body again. Lots of people feel like they've lost trust in their body, and trust takes time to earn. It really does. So, if you're one of the people that feels like you've lost trust, then know your body, start to relearn your body and pay attention. We often talk to people about something called a 2-week rule. If you've got a symptom, watch it for a couple of weeks. If it's progressing, talk to someone about it. Talk to your GP about it. Talk to your treating team about it if you're going to see them. Don't just ignore it. It's like when you see on kind of all the adverts, if symptoms persist, see your doctor. Same in this. And a lot of the time what you'll find is the headache that you thought was a brain tumour, or, the tummy ache that you thought, oh my goodness, now there's cancer spread to my tummy. Think twice. It is normal to have these thoughts. It's normal for us to have these thoughts, and we work in cancer care all the time. So you've got to work out what to be alert about and what to be alarmed about and what you need to do. And that takes time. And to be perfectly honest with you, for most people, it's going to take at least a year after you were diagnosed, and for lots of people more like 2. It's not always going to be that intense, but it is going to be around for a long time. The health anxiety is normal. Try not to get really, really crabby with the doctors when they don't scan you at the drop of a hat. They are having to find a very, very careful balance between scanning you to do something about it, scanning you for peace of mind, and realizing that scans have to have a purpose, and some scans, if you do them too often, come with a risk of exposure. Okay, so trust your doctor to be able to talk with you openly about which scans you really need that are going to affect your health, that are going to affect your treatment outcomes, and which scans actually might just be about patting you. Now, some people say, that's it, I give in, just stick me in the CT scanner and I'm just going to live in there for 2 years because then I'll be okay. Clearly, you can't do that, okay? So really engage the people that are looking after you about what you feel like you need and what they're offering. And sometimes if you don't feel like you've got a lot of confidence in your treating team, own it, do something about it. Talk to your team about that. If you're not getting anywhere with your team, think about other people or other medical teams that you do feel confident with following you up. Most of the time it doesn't need to happen. Sometimes it does. Sometimes you and your team, for whatever reason, have just developed antibodies to one another. What's most important, you're the patient, feel like you can get agency of it, you look after it, you get the follow-up that you feel confident with, but also take ownership of building the trust between you and your doctors. Okay, so mind your stress. That's important too, okay? Not because there's a big clear link between stress and cancer. It's a whole other story, okay, that we could talk about. But because stress is not nice, stress does affect our bodies, and stress is going to affect other aspects of your health and lifestyle and well-being. So don't, ignore your stress levels, manage them. And part of managing stress is actually thinking about those things that matter in your life, the things that you care about, the things that you want to spend time doing, and actually doing more of them, okay? Not because we don't know what's going to happen, but actually because we do know what's happening. We know our lives now, we've got our lives now, and actually they need to be pretty pleasant. So take this time to stock take. It's all right. Don't get all spooked out by that. It's important to take a regular stock take of your life and live a life that matters to you and that you want to be living. So it's a good opportunity to do it. Do it. So lots of people say to me things like, I do want to be kind of the person that I want to be, but there's a bit of me that doesn't, actually. There's a bit of me that wants to change stuff. That's perfectly normal. It is perfectly reasonable. So this is a good chance to start to do it, living a life that matters, okay? Remember too, with fear of recurrence, it does get better over time. There will be peaks and troughs, okay? There will be times like when you're going to have, a mammogram, like when you're going to have your monthly blood results, like when you've just come out of bone marrow transplant, and you're in regular, blood tests, and that's okay. Every cancer is different, and there are going to be times when they have peaks of surveillance and troughs. And whenever they're coming into a peak, you're going to get freaked out. Some people even find that, a few years down the track, they always know they're a bit funny this time of year because that's the time of year it was diagnosed. It's okay. There are lots of things like that happen in our lives. It is normal. Don't try to do it alone. And just be a bit nicer to yourself. If you know that you've got your mammogram coming up, your yearly mammogram, and you feel a bit weird about it, then please don't cram everything else into that week as well. So just be kind to yourself, actually. You have been through an awful lot. It's actually not a realistic expectation of yourself to think that you go through what is essentially a massive trauma and you walk out the other end feeling fabulous and confident and self-assured and, secure and wonderful and enlightened. You don't. No one does. The bruises, the literal bruises, the emotional scars, the physical scars, they take time to heal, and be patient with yourself. And if you are showing this to someone else that you love, that you feel is not quite there with you, then I'm saying to that person who's the carer, be patient. Getting back to normal, whatever normal looks like, does not happen like that. Okay, and it doesn't happen because someone tells you that you should feel normal again. No, you shouldn't. You are you. You are a human being. You have been through a lot and you will come out the other end of it. But please, kindness is really, really important, okay? The last thing I want to say is, lots of people that I see with this get all spooked out about having a future. Oh, I can't make a plan, I can't go on holiday, even to the point of they don't want to buy the winter coat or the nice pair of shoes, because they won't get the wear out of them. Seriously, buy the shoes, have the holiday, make the plans. We all have a future. We all do. We need that. Everyone who is living our lives and living them well deserves a future, and so do you. So don't get all spooky and what's the word? Superstitious is the word I'm looking for, about making plans, making holidays, buying things, doing things. Yes, you might not feel after you've been through a lot like having a 5-year plan. I don't do a 5-year plan. Most of us barely think to next week. But do think next week, think next month, think within terms of months. And now I'm not saying months because, this woman's only saying months. I'm not saying months because we don't know how much time there is, until you may have to face cancer again, or if you ever face it again. I'm saying months because, frankly, how many of us ever really, really, really think a lot beyond that? So we've all got to have something to look forward to. And there's this lovely sort of greeting card. Sorry to quote greeting cards, but it's this greeting card that I love, okay? And it says something like, happiness is something to do and someone to love and something to look forward to. And so when we're trying to kind of stitch our happiness, something to look forward to is a part of that. Okay, so there's some few ideas on living with being frightened about the cancer coming back. There's more ideas as there are on our website. And I think just realise, it's normal. Of course it's normal. Your body is trying to look after you. And so it's okay. Meet it halfway. Look after it too. Okay.